Now it's been talked about before. Now can a a psychiatrist diagnose a politician's mental illness um, for office being diagnosed from afar? Now back years ago, Barry Goldwater had been running for office and he was diagnosed as unfit to hold office without really people looking at him. It was a it was a presidential year. It was a presidential election year. A magazine called Fact had reached out to 12,356 members of the American Psychiatric Association, also known as the APA, about the Republican presidential candidate who had hailed from the party's extreme right wing and was intensely disliked by Democrats. Of the 2,417 psychiatrists who had responded, nearly half said the Republican nominee was psychologically unfit to be president, or as I would like to call them, Republican squatters. With that being 1,189 people, and with the rest split almost evenly between saying that he was fit, which was 657 people, and 571 saying that it was demurring altogether. Even though this means that fewer than 10% of the APA members actually denounced the Republican candidate as mentally unfit for office, the ones who did so used such colorful and memorable language that it made headlines. To understand why, simply look at one of the choice quotes from the anti Goldwater psychiatrist. He's a mass murderer at heart, and a dangerous lunatic, and any psychiatrist who does not agree with the above is himself psychologically unfit to be a psychiatrist. Um, See, I don't know much about Barry Goldwater. I can't say that he was a mass murderer or that he was a dangerous lunatic. Now, if you want to talk about somebody being a mass murderer and a lunatic, take a look at Trump. Now, now, while one might imagine those words being written about former squatter Donald Trump, their actual target was Senator Barry Goldwater of Arizona, who had ran in 1964. He ran in the 1964 presidential election against Lyndon Johnson. Even though the Johnson-Goldwater contest happened nearly 60 years ago, Americans are still living with the ramifications of these psychiatrists' public statements, and for one thing, it would never be clear if they contributed to his landslide defeat. With that being said, Goldwater eventually sued Fact magazine for defamation, and he won, achieving an important symbolic victory over the Democratic media outlets that had attacked him. Now, even before Goldwater's legal victory, however, the APA released a new rule. It was later dubbed the Goldwater Rule, which prohibits psychiatrists from publicly commenting on an individual unless they have previously performed a thorough clinical examination on them as a patient. Now, in theory, the Goldwater Rule stops psychiatrists from abusing the public's trust by misleadingly presenting some subjective partisan opinions as objective as objective medical information. Yet a bipartisan case could be made that the Goldwater Rule is out of date, which I would agree on that one. Many of Trump's critics claim that the Republicans show signs of narcissism and serious psychological diseases, while President Joe Biden's opponents often accuse him of dementia and other cognitive disorders, which is something that Trump has. Few media experts would argue that it is appropriate for lay people like pundits to diagnose politicians, but does that mean mental health professionals should not be able to offer informed observations? Salon spoke with 5 mental health experts on the subject, and only one of them, psychiatrist Dr. Paul S. Applebaum from Columbia University, offered an unqualified endorsement of the Goldwater Rule. The Goldwater Rule is relevant today for the same reasons it was relevant when it was adopted, Applebaum told Salon by email. Psychiatrists, the only mental health professionals technically covered by the rule, are not capable of rendering accurate diagnoses in the absence of a personal examination. Doing so risks dissemination of inaccurate information that can harm the person supposedly being diagnosed, and this kind of shoot from the hip approach to diagnose can legitimately call into question the objectivity and responsibility of the psychiatric profession, thus deterring patients from seeking further care. Now, the other 4 mental health professionals were highly critical of the Goldwater Rule, albeit in varying degrees and by raising different points. The problem with the Goldwater Rule is that it arose out of a political compromise. Now, Dr. Bandy Lee, who was fired from Yale University in 2020 for making public statements about Trump's mental health and the the squatter's first impeachment lawyer, Alan Dershowitz, Lee pointed out that only a small percentage of the APA psychiatrists from 1964 had responded to the fact questionnaire, while most recognized the survey was sketchy and unreliable. And Bandy Lee argued that the APA's motives for creating the new rule were not as pure as they might want people to believe. Instead of keeping the professional world separate from the sensational, the American Psychiatric Association capitulated when the highly political and mostly discredited for being overtly Republican American Medical Association pressured it to respond, Lee explained. And this is how the APA became the only mental health association, probably in the world, to have the Goldwater Rule, a rule that violates the Geneva Declaration and most other core tenets of medical ethics. So I believe it should either be radically modified or be eliminated, since there is a clear public interest in allowing psychiatric professionals to express grounded concerns. Of any interest to the public are fitness and dangerous, and these are different mental health assessments than diagnoses. Bandy Lee pointed out, given the dangers of fitness in an influential office, it should be one of the most vital societal responsibilities for health professionals to point this out in order to protect the public's health and safety. Bandy Lee also noted how she had experienced the adverse career consequences as a result of the Goldwater Rule, namely her firing from Yale, and described this as an exemplary of the current authoritarian trend of silencing whistleblowers and truth tellers, which was particularly ironic given that Lee said she was not part of the APA at the time. But in a similar vein, Dr. Jerome Kroll, who's a professor of psychiatry emeritus at the University of Minnesota, Twin Cities, had also characterized the Goldwater Rule as oppressive to psychiatric professionals. What psychiatrists owe their patients confidentiality, respect, thoughtfulness, technical knowledge has nothing to do with offering public comments about a public figure about whom there is a controversy, Kroll wrote to Salon. But yeah, that is true. So basically, if you're a psychiatrist, basically what a patient tells you is basically confided in confidentiality, meaning that what you tell the doctor or what you tell a psychiatrist, they cannot relay back to anybody. So I see this as an issue of free speech, which often leads to ill-advised, divisive, even stupid statements, but not to an ethical breach of my professional responsibilities. But a court of law can determine my liability if the person commented on takes offense. Now, Kroll added on, those psychiatrists who think the Goldwater Rule is just incorrect and self-serving think that the APA leadership have no special expertise in ethical issues and no mandates to intrude upon, which is Article 1 of the Bill of Rights. Now, Kroll also drew attention to how the APA seems to not entirely comprehend how day-to-day psychiatrists do their jobs. The Goldwater Rule deems things like an in-person interview and obtaining a full psychiatric history and medical report as being essential to making informed psychiatric observations, and yet celebrity persons reveal much about themselves, whereas regular patients can and do often withhold important information for various different reasons from their doctors. In both this way and others, the notion that a doctor must physically meet someone and know them fully to make accurate assessment fails in the face of doctors' real-world experiences. Now, doctors in emergency rooms frequently have to make rapid diagnosis and important decisions of persons that they have never seen before, and they have little to reliable information and no previous health records and no reliable way to evaluate the accuracy of the person that they are assessing. Yet they have to assign a working diagnosis and a treatment plan, such as involuntary admission to a psychiatric ward, on just a few salient features of the interviewed person, and this is accepted, and this is an accepted and ethical practice for doing so. And there is no luxury of delay in the ER other than perhaps an overnight stay for observation. The APA leadership just ignores these realities of daily work of psychiatrists. Now, when a psychologist, Dr. Romani Durbosula, explained to Salon why she thinks the Goldwater Rule tends to be overinterpreted, the professor of psychology and expert on narcissistic personality disorder and narcissistic abuse likewise detailed how the rule contradicts the realities of life in the medical profession. I think back to what basically she thought back to when she graduated school, when we were regularly tested and did case conferences on the basis of cases that we would read, and then provide a diagnostic hypotheses on and on. So we were reading about behavior, history, etc., and formulated a hypothesis. Der Basula had recalled, and this is an anonymous or fictional person, but basically, in fact, we were drawing a diagnostic hypotheses on someone without having treated or evaluated them before, which are the assumptions of the Goldwater rule. In Der Rasula's point of view, that example from the education system illustrates how modern approaches to the Goldwater rule take a potentially admirable impulse and move it too far into one direction. Now, if a person is in the public eye and we were able to observe their behavior and their use of language, their appearance, and also have other historical data on them, past behavior, shifts from past behavior, in which people acknowledge that is the only publicly facing behavior that we are seeing. Is it any different than a client coming in and telling us what they tell us and leaving out what they want to leave out? Now, Dr. David Reese, a psychiatrist and expert in mental fitness evaluations, who, along with Bandy Lee, contributed to the book The Dangerous Case of Donald Trump, 27 psychiatrists and mental health experts assessed a squatter. Likewise, told Salon by email that he believes the Goldwater rule definitely should be reformed. Now, he acknowledged that there are good reasons to apply some limits on what mental health professionals can publicly say about public figures. The Goldwater rule is at least out of date, and in my opinion, it was never well conceived. If nothing else, it does nothing to distinguish between attacking a politician's policy views by attributing them to mental illness, which Reese agreed would be unprofessional, unethical, and clinical, and the clinical observations that are not only medically valid, but it also can be serious enough to warrant the public being made aware of them. A psychiatrically impaired squatter is capable of doing so much harm, Reese told Salon. In my opinion, it is irresponsible for mental health professionals not to inform the public and initiate discussion regarding concerns based on objective facts and not speculation. Now, indeed, Bandy Lee had believed that already happened in the case of Trump during his squatting in the White House. Everything that was predicted happened, with the exact severity and the precise time course we estimated, Lee told Salam. This should not be surprising, since it is our area of scientific and clinical training. The right way to think about the Trump squatting was not only to focus on the individual itself, but as the APA did, but on the larger cultural phenomenon of his rise, what it indicated, and what it would do psychologically to a larger society if we continue to allow it to happen. Because Trump is running for squatter again, his mental health will once again become a focal point of public attention. And yet, there are also public questions about Biden's mental fitness, and while some of that criticism may be dismissed as being old age, many believe that there are legitimate concerns. I have not personally observed any statements or behaviors by Biden that suggest cognitive impairment, including when I personally met and spoke with Biden on a totally non-clinical basis prior to his election, Reese told Salam. It is well known that Biden has had a lifelong stutter from when he was a kid, and it has been the basis for speculations about cognitive impairment. At the same time, Reese also stated that, regardless of a president's party, all aspiring POTUSs should receive a medical and cognitive fitness for duty evaluation, but Lee also supports that kind of testing. If basic mental fitness tests for presidents and presidential candidates were impossible to implement, then at least we should be able to inform the electorate on the basic principles of mental health for the public to be able to protect itself. Now, mental health experts were muzzled and excluded from public discourse in order to placate the then squatter or president, Lee explained. So basically, if you like the video, you can give the video a like and subscribe to my channel, RBW King. You can also hit the notification bell so you'll be notified when a new video comes out. And if you want to support my work even further, you can donate to my Patreon link, which you can find in the About section of YouTube. And for just a little as a few bucks a month, your donation can help go a long way, and thanks for listening.